took over Dr. Brennan Stack's practice just shy of 5 years ago. It's flown by so fast, it's unbelievable. But our focus is on the jaw joint and the various ramifications that can occur when the disc that's on top of the jawbone is out of place. The patients we have seen they have severe pain cases, migraines, they have tics, Tourette's type things, tremors of the hands and feet. I just saw a woman who had her leg tremored until I adjusted her appliance just right. Then the tremoring of her leg stopped. And it's all because of a TMJ disorder. The jaw joint, when it's out of place and the disc is out of place, hurts the nerves. Dr. Brendan Stack started all of this 50 years ago. He was totally ridiculed for many, many years. But nowadays, it's becoming more mainstream. The problem I have is when I talk to a neurologist and try to tell him or her what I do, I generally get the and okay, and move on to how many drugs they need to take. But we do try everything we can. And once the jaw joint is in proper position, then the body functions better. In addition, I make sure the cranial bones are level. And if you've seen me on Facebook with some of the x-rays, you can see that a lot of people I meet are all twisted up. The ear is like this, and then we know they're in very bad shape internally. The internal cranial bones are shifted, and we've got to do this to them. And it's kind of like opening up a garden hose. That's like a garden hose, when it's kinked, the water won't flow. We do this and open it up. So that's kind of what we do.
So you had mentioned something about earlier about putting something on the teeth. Can you hear me okay, Dr. Brown?
Great, actually.
Perfect. Just want to make sure. You had mentioned something about putting something on the tops of the teeth, especially in children. Let's kind of segue into children, because it sounds like a lot of the things that you're talking about. Let me clarify one thing, though. You're mentioning a lot about the disc. So that would be the disc around the TMJ. A TMJ is a jaw joint, right? And within that jaw joint, there's a disc that plays an integral part of the way that your mouth behaves, correct?
Correct. Okay.
And so with that, when that disc is out of place, we start to have issues as we grow as an adult, correct?
Correct. What I like to do is, if I could meet every 3-year-old in the world, I would be thrilled. What I would do is put little plastic things on top of their teeth, like that, and that would make the jawbone come down a little bit out of the socket. All the teeth around those, we call it Bluetooth or build-ups or lifters, whatever you want to call it, that would stimulate all of the baby teeth all through here to grow up taller to better support the joint system. That would give them a big head start in their lives, and it's an amazing thing to be able to do. I see a lot of very, very young kids that have tics, headaches, migraines, and as soon as we get their jaw open a little more, the jawbone from here down to here a little bit, you take the pressure off the disc and the nerves, they feel better almost instantly. And that will stimulate all the adult teeth to come in taller too. That's what I try to do with all the little guys, and it tends to work out pretty well.
So a disc can be out of place from birth.
Correct.
Is that what I'm understanding?
Yeah, there's a
Is that part of birth trauma, or how does that happen?
Well, just think of it like this. The baby is sitting in the womb, they're upside down, twisted sideways, and their cranial bones are just all bent out of shape, and they come out of the womb. The research has shown, Dr. Fryman did this, that 95% of all newborns have a cranial bone distortion. In other words, they're like this when they're born. And unfortunately, that plays through later in life. They really never deal with it till later on, and my adult patients that I see are in very, very bad shape. Today alone, I've had 2 or 3 new ones this morning that are all twisted up inside, and they never knew until we figured out what was going on with them. And then we start dealing with it.
And is that something that traditional braces would be able to take care of?
Traditional braces will make it worse, very bluntly, because number 1, you must deal with the discs first. Number 2, the cranial bone distortions. If you just simply slap on braces, you're going to make the patient worse almost right away. And if they're not worse right away, when they're finally done with braces, I tend to see a lot of people 6 months to a year after braces, and they're in bad shape at that point. So you want to do braces as the last thing.
Instead of the first thing, which is what we see a lot going on, correct?
Correct. And I would almost all cases with children, I would use the ALF appliances. And those tend to get the cranial bones leveled out, that get the discs back in with the turbos or buildups. And it's, Julia's asking, can you ask your orthodontist for this type of treatment? In answer, probably no. It's not taught in orthodontic school. And generally in orthodontic school, they are teaching you how to really push the teeth to make them look, as I call it, pretty. I'm trying to lift the teeth up taller to make your joints healthier and happier. And I do braces, and unfortunately, notice I said unfortunately, I have to do braces. I have to do braces to bring the teeth taller to support these joints. Otherwise the patient won't get better. But I don't like the restrictive forces that I'm putting on those teeth.
I think that makes a lot of sense. So how does all of this, we kind of segued into a different area, and I almost don't know how this correlates together or if it does. So help me put these pieces together, because I'm seeing a lot of ties and mouth breathing with what I'm doing with oral health coaching, and just seeing a lot of consumers as parents looking for solutions to their kids' cavities. So does any of this come into play when you're looking at ties and mouth breathing and things like that?
Yes. Unfortunately, a lot of children have a tongue tie underneath their tongue, the little muscle pull, and I'll try to show that if I can get close, like, right there is so restrictive they can't lift their tongue up. If you cannot lift your tongue up, you cannot get a seal on the roof of your mouth to get good nasal breathing. And without good nasal breathing, you don't produce nitric oxide, which is very healthy for the body. Julia asked, why do orthodontists remove teeth? Well, it's easier. My job would be a piece of cake if I could pull and yank teeth out all day and then just close the gaps and close teeth back. But that will pull the whole face back, which closes the airway. Not to mention the cervical spine problems that are created too.
So how should a baby breathe?
Well, a baby is going to breathe very differently. It's called an infantile swallow and breathing. It's all very different from how an adult is going to breathe. And unfortunately, most of these kids that I see are a little too tongue-tied to even be able to breathe properly. So that's a whole tough one to get into, to tell you the truth. I think it would take a little too long as far as the baby breathing. We could do a whole session on that when you guys are ready. That's no problem. And I'll get my terminology down better so it's easy to get a handle on, I think.
Okay, so if a parent is recognizing that their kids are, mouth breathing or their ties and things like that, are there any early signs that a child is in some form of distress that would make you want to look at the disc or look at breathing and swallowing and tie patterns?
When I see a baby or even a little kid, by the time they're a child, they're developing a better tongue posture. That tongue should be up straight, lips should be sealed. They should breathe through their nose, breathe in, breathe out through their nose at all time. When you see a child sitting there, the mouth is like that, and they're sitting there hanging the mouth open, they're a mouth breather, you know they're not getting good nasal breathing. So you need to start looking. Is there a tonsil problem? Is the throat very narrow? The side of their tongue, you need to look at the tongue. Is it indented because they're shoving their tongue forward at night trying to breathe and open their airway? If they have a tongue tie, a lip tie, where the lip is like bumped up like that, there might be a restrictive frenum behind here. Down here, down in there, if there's a restrictive frenum too. You have to look at all the different variations. And it's so much to take a look at. I think it just takes time to understand it. And every day of the week, I think I write orders to have frenums reduced. And I use my ENT doctor for that usually. I don't know if I want to get a laser in the office, because if you have a bleeder and you have the tongue tie cut, it might cause a problem. So we're very careful with what we do about tongue ties.
Are there any specific tests that a parent could ask their family doctor? What are some of the things that they can use at home with intervention, either to determine one of two things, to determine maybe if that practitioner is well versed in what's happening. So I think a lot of times people ask like they're doctors or dentists,
Mm-hmm.
and they get dismissed, and so they feel like, okay, I've asked the question,
Yeah.
they've told me no, but what if that isn't really the right answer? What if that person isn't
Well,
up on
yeah.
what you're up on?
Unfortunately, I'd have to say 90% of the doctors don't really understand that the frenums are a key thing, the tongue position, the tongue posturing is key, nasal breathing, etc. Julia's asking about tonsils and adenoids. Do you advocate removal? No, not in the beginning. I always would try ALF appliances first. The ALF appliance will take the narrow arch, if my lower jaw is like that, and do that over time, which means the tongue can come a little forward. That opens up the airway down back. But increasing, by widening the arches, you also get better turbulence of the air going through. And what happens is the better turbulence reduces bacteria formation on the tonsils, adenoids, and maybe you don't have to remove them. Now, the people are asking about snipping tongue ties. If you do snip a tongue tie, that's fine on an infant. But as the kids get older, they need myofunctional therapy to make sure that if you snip that tongue tie, the tongue doesn't just settle back down. You need it exercised and working to get up on the roof of the mouth. So that's where the myofunctional therapy would come in.
I always explain myofunctional therapy as almost like a physical therapist, basically, for your brain and your tongue and
Yeah.
your mouth, trying to really retrain that aspect of what they're supposed to do, because just like you said, just freeing the actual tongue doesn't tell the body what it's supposed to do now. Is that correct?
That is correct. You need myofunctional therapy before, during, and after the surgery. And the surgery is minor. It's just trimming underneath the tongue or the different frenums. It's not a big deal whatsoever. But you have to understand that you have to do the therapy to get it done right. I've seen too many folks, they cut corners on this. And they're told by their doctors that you don't need to do myofunctional. And, well, we just have to have a little discussion. And when I send them for a secondary revision of the frenectomy, then they get it.
And then they get the therapy to go along with it.
Yeah, it's absolutely important. Absolutely.
Yeah. So what does, you talked about if you could see every 3-year-old. What, are there things that with parents that, or infants prior to 3, are there things that they could be looking at home to determine if their child should have an evaluation?
Okay, look for circles under the eyes. Dark circles here.
Big circles like that, like the dark bags under the eyes?
Like I have.
Okay.
And what that means is they're not oxygenating as well as they should. That means something's closed down inside here. It could be slipped discs. It could be the throat is closed in. It could be those frenums, like the frenum here and here. They're going to pull the face back like that. They're restrictive on forward face growth. Excuse me. Excuse me. Again, back to the ALF. The ALF will take the sunken face and do this and bring it forward. And that opens up the airway right away. And I see a lady, Sherry, just said she had her daughter, the tongue tie was snipped at age 3 and it grew right back. Right. If you don't do myofunctional therapy, yes, it will sink back down again. So very important.
Very important. So what does early intervention look like for a little child? And at what age would early intervention be considered?
Well, if I could get 3 to 5-year-olds in here, I would be thrilled, because a lot of them, when you look at their bite, again, this is a side view, the teeth upper and lower should meet like that. A lot of these kids are like this. The bite is too deep. And Julia's like, oh. Well, when that is happening, that means that the face is like, and imagine how painful that's going to be to the body. A lot of the little ones that I see don't know that they're hurting. And I palpate the muscles to check on them, like through here, everything through here. And when I press and they cry, they're hurting so bad, the mothers fall apart in tears because they didn't know little Johnny was hurting that bad. And it's an amazing thing to see these kids react to my palpation exam. And I'm just pressing, no harder than that. That should not hurt a child whatsoever. And when you see them cringe and tighten up when you press them like that, you know they're in bad shape. They didn't know it because they thought it was normal. So look for the deep...
They don't know any difference, right?
Yep. Look for that deep bite. That's one thing. Look for the open mouth all the time, breathing in and out through the mouth. That means something's clogged back in there. And then if you can teach the kids nasal breathing, that is to their benefit greatly. I know the first time I did nasal breathing was about a year ago when I walked home one day and I kept my mouth shut the whole time. I thought I was going to pass out. I could not breathe through my nose. Then eventually it cleared up a bit. So, and all that ties into sleep as well. If a child snores, that is not healthy. It's not cute. It's dangerous. Understand that right away. It's dangerous if a kid snores.
Dangerous. Yeah, I like that word because it really is dangerous. We thought for so long, oh, how cute the little sounds.
Yeah.
No, it is not healthy.
Sometimes you want to look at allergies.
Says, Julia and Carrie, if you are on your cell phones on the updated Facebook app, you can request to join this video. So it's got to be on a cell phone and not on a computer. So I think that's where I went wrong. Megan, thank you so much for that. Next time we will know exactly what we're supposed to do with that. So yay.
Yes.
Yay for next time.
So now there's another thing you can look at too for your kids. I went through this with mine. My son Paul nearly died at Fairfax Hospital. They said he had asthma. He was on all this medication, had the nebulizer going every night. Turns out he was allergic to dairy products. And a lot of children are totally allergic. So you want to look at that issue too. Don't listen to the pediatrician if they poo-pah you. It took me 20 years of battling with my own pediatricians, who are now all retired, to finally believe that dairy causes all sorts of problems. There's a site called Not Milk, Notmilk. Check it out. There's a tremendous amount of information there about the dangers of dairy products and the inflammatory condition that it causes in your body. So take a good look at that. The other thing is gluten. We try to get our patients off of gluten because that causes inflammation too, and the body just cannot heal. That's right. Julia says casein creates a glue-like substance in the lungs. Well, imagine it's in the intestines too, and it takes, like, if I remember right, a good 30 days. If you have a chunk of cheese with dinner tonight, it will take 30 days for that stuff to clear your intestines. Yuck.
Wow.
Yeah.
That's a long time. It's interesting that you say that because we went on vacation and over in England. I don't know what it is, but my son loves to eat cereal over there. And here we don't really eat much cereal at all, but now it's become kind of a staple thing for him, which means more milk. He's not a big dairy eater anyway, just inherently doesn't like it. But I am hearing so much more mucus in his system. So it's really interesting that you say that.
Switch them out to, if you would, Carrie, try coconut milk. If you can find soy milk that is organic, I don't know if I believe that anymore. The soy milk 20 years ago when my son was really sick, that was good stuff back then. Unfortunately, 80 to 90% of soy in this country is now GMO, genetically modified. In other words, it's crap. I didn't say that on public TV, did I? No, it's good.
You didn't.
Anyway.
Hey, I wanted to ask you quickly too, with the Alpha appliances, how long in life, or how old do you actually get benefits from an Alpha appliance?
All ages. I have many people over 65 wearing them now. And I use it as a very conservative procedure. They feel better, they sleep better, so they're oxygenating better, and the body heals faster. So they wear their Alfs, and even when I'm done expanding the arches, and it's only a little bit, a few millimeters, makes a huge difference in their health. And what happens is I have them wear them at nighttime as retainers, because all day long you are sitting at your computer and you're doing this all day, getting tighter and tighter and tighter like this. The Alfs just simply bring you back open again and support that position. So I have them wear them at nighttime forever and ever, or until they really don't care anymore.
So is an Alf, if somebody hasn't seen one before and they're trying to picture it, is an Alf almost like a retainer metal bar?
Well, next time, what I could do next time, Carrie, is have I can show everybody the various appliances. I've got, let's do that next time because I can show very readily. It's in my other room. But the Alf is a wire. It's an L-Jaloy wire that is 0.25 inches thick. It's really an amazingly thin device. It fits behind your upper teeth and lower teeth. And I'm actually going to be teaching this stuff in Toronto in a couple of months. If anyone is interested, it's for doctors only at the moment, but eventually we'll get back into assistants and the public. And what I teach with this stuff is that the ALF allows the body's natural genetics and DNA to be expressed. Right now, we're all being so held back, held down by our terrible diets, lack of exercise, sitting in a chair, typing at a computer all day long. And let's see, Sherry's asking ALF dentist, braces are only optional? No, I do not use braces very often to finish whatsoever. I don't like to do that. The only time I use braces are extremely severe cases that require huge amounts of lifting of the teeth, but not in general do I use braces. Anyway, the ALF will give these people the support they need for longevity and better health. And that's what it's all about. It's all about health, and that's what I care about. When I do ALFs for my patients, like the couple people this morning that were new patients, I said, we'll do ALFs. You're going to get gaps in the back teeth. And that's good. It's wonderful. But you're going to complain. You're going to moan and groan at me that food is getting caught. I'll say, that's good. We've expanded your bones. We've made more room for your tongue. Health is so much more important than the pretty, pretty teeth.
I want to just wrapping this up because I know you have clients or patients to get back to today.
Oh,
I had a couple questions that came in when I told people that we were going to be doing this interview, and I want to make sure that we have a chance to get to those.
Sure.
One of my listeners asked, has there been success from palate expansion alone resolving mouth breathing?
Not really. See, the problem with a rapid palatal expander, it cracks the midline suture up in there, and the relapse rate is 60%, which is not very good, I think. Okay, palatal expanders, I wrote a blog on it. If you go to my website, you'll find it, but the gist of it is the palatal expander forces the jaw back, which crimps the joints. Strike one. Strike two, your tongue does not get to the roof of the mouth where it belongs, therefore you don't get good nasal breathing. Strike three, it locks the maxillary bone, the upper jaw, in place, which locks up the internal cranial bones. Therefore, less cranial motion, less pumping of the skull like it needs to move. Your skull has to pump cerebrospinal fluid 12 to 14 times a minute, approximately. And if it doesn't do that, it doesn't work. You'll just get worse in different ways. So rapid palatal expanders doesn't work for me. Haven't used one in over 20 years. My God, I'm getting old.
Thank you. That was a perfect question. And the other one that came in was about, has tongue tie or lip tie relief alone been enough of an intervention to improve mouth breathing and sleep apnea? I think we also addressed that in the fact that myofunctional therapy along with that is necessary. But
Absolutely.
Do those two things together, have those been known to be enough, or is there typically more and more and more and more treatment that needs to be done? At what point do you start to see resolve for these kids?
Yeah, I tend to find, like I said, do the turbos and build-ups on the really young people, but if you trim those tongue ties and then there's really good nutrition to back it up, sometimes the jaws will grow forward and start to blossom, so to speak. And a lot of times, though, it's often pretty late in the game. Like I said, 95% of the kids born with twisted cranial bones. You have to work on that, and that requires ALF appliances. So it just takes time.
Takes time.
Yeah.
All right, so it sounds like that's probably what people need to really hear is this just takes time. There isn't really a quick fix, but when you do get the fixes, you're looking at lifelong solutions.
Yes.
To the bigger problems. I always tell my parents that I'm finding, or that are finding me for, alternative intervention for their kids' cavities, because that's what a lot of them find me for. And I said, you know what, if your child has to have a cavity in order for you to get to this deeper information that you likely wouldn't have gotten to, I'm okay with that, because we can fix the cavity and we can work on the bacteria. But if this stuff isn't done, you're just going to end up in that cycle over and over and over again. True.
It's just, like I said, a matter of time. If you can be patient, be a patient, as I tell our people. And we have a sign going in my waiting room eventually. We are not FedEx. And that's the important thing. One of the good messages here today is no one can move things rapidly and fix things overnight. Only FedEx can do that, and we're not FedEx, so get over it.
Build a bridge, get over it. Okay, so wrapping this up, what best advice do you have for parents?
I think it's really important to find all children should be screened by somebody who understands about TMJ disorders and cranial bone distortions. In addition, it's understanding of the cervical spine, because anything you do here will affect the cervical spine. And I recall, like another one just today alone, came in with a whole bunch of dental appliances, and they were so high, they jacked her up, the bite so high, you could tell it was spinning the neck out of place. And unfortunately, that's where some of the training stops with these doctors. They don't have a full handle on this. I'd like to thank Dr. Derek Nordstrom for he took me under his wing over the years, and I will have to give him a lot of credit for what he has done. I now understand how the tie-ins are with cranial bone distortions, the cervical spine, and how it affects the entire back, neck system. You've got to look at the whole person when you do this work. And as the general dentist out there, it's very difficult to do general dentistry and try to do this at the same time. And there's my frustration, I guess, at times, is some people have a little piece of the puzzle here, a piece here, but if you can find a person to work with that can put all these pieces together, I mean, heck, I learn more and more and more every week. I'm starting to study hypnotherapy and how that affects patients and their grinding habits, more of the dietary things that are going on, all sorts of different things. And I learn every day of the week. And that Thad is right. Thad's posted, orthodontists ignore the cervical spine. They just force the teeth where they look pretty. And then that's when I unfortunately have to step in.
Unwind all that stuff, huh?
Yeah.
Well, I can't thank you for being so supportive of FACE and us as an organization. Having you be behind us and always willing to help us learn, and also you doing what you can to spread your message is great. I really truly believe in the organization of FACE and getting out there and teaching. You're doing the dentist stuff, and that's wonderful. But really, in order for this to really get into the hands of the patients, if you will, and the consumers, if you will, we all need to be carrying this torch and going down different paths in order to bring people back to the same path together. So that's what I admire so much, is you're knee-deep in patient care, and you're knee-deep in working with dentists, and we're really out there with the consumers and with the clinicians, getting this information so that they can find people like you instead of just taking information at face value, learning how to be an empowered consumer and an empowered clinician and make the difference in lives, because it's not about tooth carpentry, it's not about gum scraping, it's so much more that we can do to save lives and change health overall. So thank you for supporting us.
So welcome. And then don't forget
coming on and always being supportive of what we're doing.
And the folks, don't forget, FACE is going to be doing another program in, I forgot what town in Canada, but somewhere up north of here in the coming year. They're already working on the program, so stay in touch. Julia and Carrie will tell you folks when that program is, and I believe it's going to be oriented towards both consumers and doctors, etc. So it should be very much fun. Let's get I would say, Carrie, try to get the word out there pretty soon. Oh, New Brunswick in August. Okay, try to get the word out so people can plan and be there. That would be a great thing to do. We're going to have some great speakers. I'm trying to bring my own PT doctor, Dr. Logan Cooper, with me. The guy is fantastic. And if you ever had a chance to work with him, you'd understand what I mean. I've had everybody say he's wonderful, so I'm trying to get him to show up too.
I can't tell you how cool it was at the inaugural FACE Symposium to see you guys all sit down and look at things together and talk about stuff. It just really, the light bulb went off so many times, seeing different thought processes from different people and how that all comes together to create success for the end user, which is the patient, right?
That's exactly right. So that's our goal, Carrie. Let's get that end user happy. That's what it's about.
End user happy and healthy, absolutely. Well, I know that there's some end users that are waiting for your time, so thank you so much.
You're welcome.
Where can people find you in the meantime?
Oh, just if you could, go to the website that we have, sleepandtmjtherapy.com. Read the blogs. I tell stories every day of the week. And I talk about insurance companies and how much I abhor them, and write on down the list. And I lay it all out there. So have fun. It's easy to read.
Thanks, Dr. Brown. Have a
You're
great
welcome all. Take care. Bye-bye.